Hello, dear colleagues. I hope this message finds you hale and hearty. From my home office, I'm sending some remarks on the WHO Interim Guidance on preventing COVID-19 outbreak in prisons, which is a challenging but essential task for authorities. So some German remarks on this interim guideline. My colleague Dr. Keppler and me we thought that some suggestions might be helpful. For instance, focusing on drug-using prisoners. For instance, the smokers of tobacco, 90% of at least German prisoners are tobacco smokers. And so many of them do suffer from COPD. So it's quite necessary, we thought, to focus on them and to offer them alternatives to tobacco smoking. So they are quite vulnerable for acquiring corona and for severe developments. Furthermore, in Germany at least, I don't know the situation in other European countries, patients in opiate substitution treatment do have to take their medications in a daily and directly observed therapy. So they have to show up to the medical unit every day. And we strongly suggest to apply other measures, for instance, other applications of medications, for instance, depot buprenorphine, which would reduce the appearance in the medical unit to once a week or even to once a month, if that is, let's say, legally possible in the States. So furthermore, we made some suggestions on how to reduce the number of prisoners and reduce the number of imprisonments. This is quite important. We thought that less imprisonments can be achieved if all arrest warrants outstanding for execution are being suspended and are not being executed. This mainly affects so-called alternative custodial sentences. That means prisoners who are not who are sentenced to a money fine and are not capable to pay that. Furthermore, increased releases. All prisoners where it is justifiable from a security point of view should be released either temporarily, which is the case in the biggest state of Germany, North Rhine-Westphalia at the moment, or as part of an amnesty in a safe environment if possible. Or suspend enforcement of penalties that would be enforced in open prison settings. This action would reduce imprisonment significantly, at least in the federal states providing an open prison setting. In Berlin, for example, delinquents with detention up to 3 years are currently not included as new entries. Most actions include, furthermore, juvenile are no longer enforced, no prisoner collective transport, and as a rule, there are no excursions or ease of detention. Furthermore, many prison administrations offered the possibility of video conferences for prisoners. In Lower Saxony, for instance, almost all of the 13 prisons do offer video conference places, 38 in total at the moment, and that gives prisoners the chance to chat with their beloved and their friends. Furthermore, there should be offers of vaccinations, and that is especially necessary, and we mean vaccination against influenza and pneumococci. That would also reduce risks of severe developments. Finally, information are needed and trainings on measures that are suitable to ensure continued care. That means trainings for cleaning personnel. Most likely these are prisoners who are cleaning the cells and the wards and the institutions. They should be given clear messages on how to reduce the risk of infections and provide them with appropriate materials for cleaning. These trainings could also be done for staff, of course, and the provision of alcohol-based hand sanitizers should contain at least 60% of alcohol at key points within the facility. If this is not possible, at least non-alcoholic means of disinfection should be provided, so-called wipes. Environmental measures should be implemented, like frequently clean used surfaces, minimize sharing objects, ensure proper ventilation, and finally the usual guidelines on social distancing should be implemented as far as possible to contain the corona pandemic within institutions depriving the liberty. Many thanks for listening, and I hope this is fruitful and helpful. Thank you.